Hey everyone, and welcome to Windpei Pet Pal. Today we're exploring the absolute ultimate truth of pet ownership, which is this. The absolute cheapest and most effective trip to the vet is the one that prevents a disease, not the one that treats it. I am literally so thrilled to have you here. In this explainer, we're going to look really closely at some of the most critical, yet kind of surprisingly overlooked aspects of keeping your best friend healthy and happy. So I always ask new pet owners this crucial question. And the answer might genuinely surprise you. When we think of medical treatment, our minds usually jump straight to high-tech surgeries, expensive antibiotics, or those scary emergency room visits. But from a strictly medical and biological standpoint, the ultimate treatment doesn't actually happen in a hospital at all.
That's right, it's prevention. Stopping an illness before it even starts is vastly more effective, significantly safer, and astronomically less expensive than treating a severe emergency after it develops. This right here is the golden rule of veterinary medicine, and it's basically going to be our guiding light today.
Okay, let's take a quick look at the agenda for this explainer. 1. Know your pet's risks. 2. The silent parasite threat. 3. Everyday preventative care. And finally, 4. Recognizing true pet emergencies. Let's dive in. Starting off with Section 1, Know your pet's risks. There's this old saying, temperament should always rank above appearance. And honestly, it really hits the nail on the head. Choosing a dog just based on looks, rather than their energy levels or inherited health issues, well, it often leads to a lot of trouble down the road. For example, a Siberian Husky is undeniably a stunning dog, right? But they are bred for full days of intense physical output. If that high-energy temperament doesn't match your lifestyle, behavioral and physical issues are inevitably going to follow. Now, specific breeds definitely have unique, predictable risks. Take the Sphinx cat, for example. Since they don't have a coat, they're prone to severe skin infections and need strict temperature control. But even more importantly, they are at a super high risk for a heart condition called hypertrophic cardiomyopathy, meaning they need annual cardiac ultrasounds. And then you have your flat-faced breeds like French bulldogs and pugs who face incredibly severe breathing obstructions known as BOAS. To put that into perspective, BOA's surgery to correct those airway obstructions for those dogs, that can cost up to $5,000. Wow, this really highlights why researching lifetime health costs is such a crucial preventative measure. Knowing these risks ahead of time allows you to either budget for the necessary medical interventions or, choose a breed that's a bit more suited to your financial reality.
So when you're choosing your new companion, consider that a massive 2013 UC Davis study found mixed breeds actually have significantly fewer genetic conditions. It's a true testament to hybrid vigor. But on the flip side, purebreds offer high predictability. Reputable breeders can provide documented parental health screenings, like OFA hip clearances or cardiac evaluations. So it's like you have a map and know exactly what medical terrain you'll be navigating.
Moving right along to Section 2, the silent parasite threat.
We're talking about heartworms here. These are literal silent killers spread by a simple mosquito bite, and they've been diagnosed in all 50 states. These aren't just tiny little bugs. In dogs, they grow into foot-long worms that physically colonize and block up the pulmonary arteries and right heart chambers. And while dogs are the primary hosts, even a single microscopic worm can absolutely devastate the internal organs of cats and, incredibly, ferrets too.
So here is the whole shebang. Giving your pet a simple, affordable monthly preventative is incredibly easy compared to the alternative. For dogs, treatment requires these highly toxic arsenical compound injections. And actually, scratch that, it's not just injections, it's also months of incredibly strict cage rest. But for cats and ferrets, the medication used to treat dogs is entirely fatal to them. Let me repeat that, because it's absolutely crucial. There is literally no safe, approved treatment for heartworms in cats and ferrets. Prevention is their only shield.
To fight this devastating parasite, veterinary experts and the American Heartworm Society strongly recommend what they call the Think 12 approach. You really can't just guess if your pet is protected. You have to guarantee year-round protection by testing annually and giving preventatives every single month, regardless of whether you live in a snowy climate or a desert. Because, mosquitoes can very easily overwinter indoors.
Keep the number 7 in your head right now. Why? Because 7 months is the absolute minimum age when dogs should first be tested for heartworms. The infection just takes time to mature. A mosquito bite transmits larvae, and it takes about 6 to 7 months for those larvae to mature into the adult female worms that actually trigger a positive result on a veterinary test. All right, let's jump into Section 3, Everyday Preventative Care.
Timing is everything when it comes to sterilization. Spaying and neutering at these specific, evidence-based ages provides profound medical benefits. For female cats, spaying before 5 months prevents behavioral spraying, but way more critically, it drops the risk of memory cancer down to near zero. And for male dogs, neutering eliminates the risk of testicular cancer and heavily cuts down on those dangerous testosterone-driven roaming behaviors. Oh, and home dental care? It is an absolutely essential component of preventative medicine. Just like us, bacteria and plaque build up in your pet's mouth. Brushing their teeth with a pet-safe toothbrush prevents that plaque from hardening into tartar. If you neglect it, a lot of pets show painful signs of periodontal disease by the time they're just 4 years old, which leads to some incredibly expensive surgical tooth extractions.
Let's break things up with a fun fact. Did you know cats can rotate their ears a full 180 degrees? No way, right? It's this amazing evolutionary trait that acts like a little built-in kitty radar system. But it also means their ear canals are highly exposed. So as part of your routine grooming, you really need to regularly check those amazing ears for wax buildup or microscopic ear mites.
And finally, for routine care, building a robust immune system relies on strict adherence to core vaccines. These are the non-negotiable shots that protect against highly contagious, life-threatening diseases. For kittens, these should be started at 6 to 8 weeks of age, at 3 to 4 week intervals, just to build up an unbreakable wall of immunity against scary things like distemper and rabies.
Which brings us to our final section, recognizing true pet emergencies.
Even with the absolute best care, sudden accidents happen. According to the experts at Blue Pearl Pet Hospital, these are the critical symptoms that mean you cannot wait and you must seek emergency veterinary triage immediately. We aren't talking about, a single episode of an upset stomach here. We're talking about severe, repeated episodes, bleeding that just won't stop with pressure, or a sudden, terrifying inability for your pet to use their hind legs.
You gotta be super vigilant for these specific, highly dangerous red flags. For instance, cats are obligate nasal breathers, so if your cat is panting or breathing with their mouth open, they are in severe respiratory distress. A dog trying to vomit but nothing coming up, dry heaving, is a classic sign of deadly stomach bloat. And a pet, especially a male cat, straining but unable to pee could have a blocked bladder. That's fatal within days if a vet doesn't unblock it.
Okay, let's end on a slightly lighter note before our big conclusion. If you're ever worried about a pet getting into your sugary snacks, just know your cat won't even care. Due to a genetic mutation, felines completely lack the taste receptors to enjoy sweetness. So if your cookies go missing off the kitchen counter, it's definitely the dog you have to interrogate. And that brings us full circle today. As we've seen throughout this explainer, understanding these risks allows for better preventative care, which is often more effective and less expensive than treating a disease after it develops. Proactive care truly is the ultimate act of love for our animals. So I'll leave you with this. What is one preventative step you're going to take today to safeguard your furry best friends tomorrow? Thank you so much for joining me on Windpei Pet Pal to uncover these vital insights. Please like this explainer, subscribe for more structured knowledge, and definitely ask us your most pressing pet problem in the comments below. We'd absolutely love to help you and your furry friend. Catch you next time.